Hi and welcome to your next unit. Today we'll be discussing CHCDIS002, follow established person-centred behaviour supports. Support people to maintain daily activities. Your role as a support worker is to support and assist your clients to maintain their activities of daily living, to help establish successful activities and routines that promote positive behaviour, a positive support plan that will provide an effective map for managing and supporting their processes. Behaviour support plans. So this plan will identify the supports required for the person, their carers and the family to address the unmet needs of the client. It will include factors such as redesigning the environment, acquisition of skills and changing the systems already in place. It's all about the positive interactions between yourself as a support worker and your client. So how do we do this? It's through our pitch and tone of our voice, it's through maintaining eye contact, being culturally sensitive, providing positive body language, respect for personal preferences, and overcoming any difficulties that you may be experienced throughout the communication process with your client. The strengths-based approach. So this is where we take the opportunity to move away from looking at what the client can't do and we focus on what the client is capable of doing. This is known as the strengths-based approach. You may come across some problems whilst engaging with your clients. This could be for a number of reasons, but a few of them are that the client is emotional, the client's not feeling well, the client does not enjoy the activity, client has a personal problem with yourself as a staff member or a staff member that you're currently working with. The environment is unfamiliar. There could be a mental or a physical disorder as well. The social model of disability. So this dictates that disability is a result of the organisation, of society and its views, rather than the physical or mental impairment itself. We also tend to come across a bit of social devaluation. So this is when you or a group of people have a negative attitude or do not value the individual or the group based on certain characteristics. We also want to maintain a safe environment for our clients. So this is the clients and their carers and their families. So we want to have familiar people present whilst dealing with our clients. We want to have familiar items and resources around to make the environment feel comfortable for our clients. We also want to remove any hazards or risk that could pose injury or harm to our clients as well. Positive and adaptive responses. So a positive response, this is where a person responds to the environment with a desirable behaviour and does not react unexpectedly. Adaptive responses. This is where the person with a disability uses their own functioning aspects of the body in order to adapt to their environment and complete tasks. When you start with a new client, you want to check their behavioural support plan. So this includes the client information, any activities that the clients do and do not like to do, the behavioural concerns and triggers around that client, the physical, sensory and social interactions and the needs of the client, and strategies to employ for positive behaviour in these activities. Behaviours of concern. This can be identified as such intensity, frequency and duration that the physical safety of the person or others is placed or is likely to be placed in serious jeopardy, or behaviour which is likely to seriously limit use of or result in a person being denied access to ordinary community facilities, services and experiences. Engaging in inclusive communication. So what does that mean for you as a support worker? Here we want to use short words and sentences and we want to repeat them often. We use visual aids such as picture cards or cue cards and we take the time to listen to what our client is coming back to us with. We can communicate by using sign language, and if we don't know sign language, we can always communicate in a written form. Some triggers of behaviour. So the people that you are working with have a range of disabilities, and with those disabilities, there can be triggers involved. The triggers of behaviours can include audible, visual, sensual, olfactory or taste related. These can be situational or environmental, time-related, or many other things. It's getting to know your client and it's getting to know their triggers and how you can minimise those. We want to ensure the emotional well-being of our clients. It is important for the clients to interact within the society and within part of their community. We keep check on our clients' responses and how they react when participating in these types of activities. We also want to be aware of any potential mood changes within our clients, and we want to then debrief with our client after the activity to find out how they felt doing that activity, if they enjoyed it, what they liked and what they didn't like, and what we can change for future. It is important that activities can be performed and that a sense of achievement is made by the client. Critical incident counselling. One form of crisis management is critical incident counselling. It is one of the therapy tools belonging to the field of crisis management. CI counselling is therefore focused on how to immediately reduce stressful situations and return emotions to their normal state. So this means when your client is displaying a negative emotion or displaying a trigger, what can you do as a support worker to minimise that and eliminate it and bring them back to being calm and happy? Here we want to look at the health of the client. So the health status may include: are they under the influence of alcohol or drugs? Are they wounded? Have they got an elevated heart rate or blood pressure? Are there any extensive sweating that's not normal for the client? Or are the client's pupils dilated? We also want to have a look if the client is experiencing any pain in any specific area. If you do notice any of these things, please take it to your supervisor and go from their guidance on what you need to do next. We also need to consider the nutritional needs of our clients. As they pose with a disability, we need to ensure that they're getting the nutrition and the vitamins and minerals that they need within their diet to sustain a healthy life. It is important that the correct nutrition is being received by your client to maintain their health and energy levels. Check with your clients' families or their previous carer that the diet is appropriate and contains the right balance of foods for that individual client. And it's for their condition that they are eating as required. Medication requirements. So with disabled people, those with elderly or any chronic illnesses, comes a lot of medication requirements. You'll need to observe and record the person's medication in context of harmful behaviour. So once again, this could be signs of distress or any changes in your client's mood, and we need to be able to inform our supervisor of any of these triggers or behaviours that are happening. Here we're going to discuss some strategies to avoid behaviour escalation. We want to be able to show empathy, and we want to do that by redirecting the client away from the area that they're becoming distressed in and put them into a calm environment. Use validation therapy, using your calm tone and pitch and your body language to be able to calm the client down. We want to remove any stimuli from the client, and we want to remove them from the environment containing that stimuli. We also want to use clear methods of communication to help them understand what's happening in their day-to-day life. Changing their work and home environment to meet their needs also helps with removing any behavioural triggers. Adding interesting and enjoyable activities to their routine in life is going to better their well-being. Reinforcement. So here we have positive and negative reinforcement. So a positive reinforcement, this is where a motivating reward stimulus is presented in response to the behaviour. A negative reinforcement, this is when a certain stimulus is removed as a particular behaviour is becoming distressful for the client. Responding to behaviours of concern. Once triggers and behaviours of concern have been identified, the plan must be adapted to address and resolve them in a prompt and timely manner. This should involve discussions between carers, care home managers, family members, and the person with the disability themselves. Safety to our clients is paramount at all times. In your work, there is a chance that unknown factors will give rise to a difficult situation when you are with a client. So what do we need to do? We need to start looking for triggers before they escalate. This will help you alter the situation and become more manageable for you. Knowing and understanding your client will ensure that you can minimise, if not eliminate, these situations. Organisational procedures. So when you're working in an organisation, they will come with a set of policies and procedures that you need to work with. Your organisation will have established procedures that are designed to cover all circumstances, and you need to make sure that you are aware of these procedures, as they will impact your job role from time to time. Changes to the client's personal care requirements. This can be related to a number of things. Here we've got some sensory difficulties, mobility issues, new conditions, injuries, new requirements, worsening of existing condition, new or changed preferences. You will often have to use external providers, and there needs to be a referral process that goes along with that. Some of the external providers that you may become familiar with could be psychologists or psychiatrics, local doctor or the nearest hospital, the emergency rescue services, critical incident counsellors or education support. Once again, if we need to report any changes in our client, we can do this through verbal communication to our supervisor, directly to the supervisor, or at the end of your shift at handover. We would also follow this up with a written report. This could go into the client's communication or progress notes. It could also go on any of your client's charts. So this could be a behaviour chart that is currently being conducted on your client. So if you do observe that there are any changes in behaviour, you could use this document to write down those changes that you've observed. So once you have gone through the PowerPoint presentation, along with the learner guide, you will come to a series of questions that you will need to complete. These will involve skills assessment, knowledge assessment, and performance assessment. If you're experiencing any difficulty with any of these questions, please contact your trainer directly, as they're more than happy to assist you in any area that you need. Once again, thanks for watching, and I'll talk with you soon. Bye.